Hi, so today I'm here to share the results of my recent blood work with you. A little bit of background on me first. My name is Jocelyn. I've been doing CrossFit for more than 10 years. I'm 35, I have 2 kids. I have been following a ketogenic diet, a cyclic ketogenic diet, since January of 2017. So at the time that this blood work was done, this was done September 28th of 2018. So that's 21 months following a high-fat, low-carbohydrate diet. A typical day for me looks like less than 25 grams of net carbs, about 120 grams of protein, and about 180 to 200 grams of fat. Now, with that much fat in the diet, I've had many people ask me, what does your blood work look like? And I actually have not had blood work done in more than a couple years. The last time would have been when I was pregnant, which was just over 2 years ago now. So I finally went and ordered all kinds of tests. My doctor was nice enough to play along with all the extra things I asked for. So the long story short, everything is great. If you don't want to listen to the rest of this video with me go into detail about everything, just know that I am healthier now than when I was 19. For some reason, when I was 19, I had also gone to my doctor and requested a bunch of cholesterol tests and all sorts of things. I guess even back then I was interested in this self-experimentation stuff. So I do have a few compare to numbers from 16 years ago. And the good news is that everything's better. So I'm going to go into each thing in a fair bit of detail, but if you don't care about the detail, just know that I'm very healthy. So we're going to start with vitamin D. I requested a vitamin D test. Not every doctor will do it. They're expensive to administer, especially in people where they don't suspect there's a problem. She was nice enough to order it for me. This would probably not be a regular thing that I would be allowed to test, being a burden on the healthcare system. My vitamin D was 105.4, so this puts me in the optimal range. I was actually quite happy with this, as this test was done at the end of September, and the weather in September was terrible. I had not really been outside for most of the month, so I was glad to see that my vitamin D levels were still right in the normal range. I also had not started taking supplemental vitamin D, which I do all winter here in Canada, where I do not get enough sun exposure. As you know, vitamin D is one of the fat-soluble vitamins, so it's not a surprise to me in any way that my vitamin D score was great. B12, right in the smack dab normal range, 255. I actually was B12 deficient when I was 19. So I was that was one of the things I was curious about, whether I just had a genetic deficiency in B12 absorption or something. But I think it was probably just that my diet was quite a bit worse when I was 19 and partying more than I do now that I'm 35. What else is interesting? My iron levels are normal. My ferritin levels are right at the top end of the reference range, which is your measure of stored iron. So that's a good thing. You don't want it too high or too low. Thyroid function. So my TSH is 1.02. Now the reference range it lists here is 0.27 to 4.2, which is quite a big range. I think a more optimal range here from what I've read would be like 1 to 1.5, and mine was just over 1. So thyroid function, looking pretty good there. My free T4, the reference range here is between 12 and 22. Higher is better, the higher end would be better. Mine was 20.4, so I'm right on the high end of the reference range. That's interesting to me, as there is some talk out there about women on ketogenic diets that it possibly causing some thyroid downregulation issues. That has clearly not been my experience. My thyroid is kicking just fine. My lipids, this is what most people are curious about, my cholesterol. Now, total cholesterol, which is a completely nonsense number that doesn't mean anything, but I'll tell you what it is anyway. 5.55, this is high, but total cholesterol is doesn't tell you anything useful. These are all in millimolars. I'm in Canada, so sorry Americans that these numbers might not make sense. Triglycerides, my triglycerides are low, so mine are 0.58, and the reference range there is 0.6 to 2.3. So triglycerides low, that's good. My HDL cholesterol, that's your good cholesterol, high density lipoproteins. Mine is on the high end of the normal reference range, so 1.77. The reference range there is 0.9 to 2.2, so I'm like basically right in the middle. This is better than when I was 19. My HDL cholesterol is now better now that I eat more fat and don't eat as much junk and party as much as I did back then. LDL, so this is an LDL-C number, also not very useful. is slightly on the high end, so 3.52. The reference range there is from 2 to 3.4. This is up from when I was 19, but that would be pretty much exactly what you would expect on a low-carb diet. This is a pretty typical lipid panel for someone eating a lot of fat, not a lot of carbohydrate, and definitely not a lot of sugar. The cholesterol ratio, so this is like your risk score, mine is 3.1, which is so good, I don't even hit the chart. The female average risk number starts at 3.4, mine is 3.1. My cholesterol ratio when I was 19 was 3.9, so I am at less risk of cardiovascular events now than I was 16 years ago, so yay. So my HDL is very good, my LDL is also elevated, but like I said, that's a pretty typical thing to see on a low carbohydrate diet. Now there are people much smarter than me with a much deeper understanding of that than me that I'm gonna link to underneath this video, so that if you really want to go down that rabbit hole and learn all about LDL cholesterol, you certainly can do that. Like I said, this is my LDL-C number, which is not very useful. I asked my doctor about a follow-up particle count, and she did not know what I was talking about. So I'm gonna see if I can get my hands on an LDL-P test from somewhere, or even if we can figure out for her how to check the box and order it. LDL-C tells you, it's kind of like the number of people on the road, which is a rough estimate of something, but doesn't really tell you a whole lot about what traffic is going to be like. Where an LDL-P would be an LDL particle count, that would be like the number of vehicles on the road. So most likely what we would see is that my particle count would be lower. So that's like having more people in mass transit. That's like having lots of buses on the road where each bus carries lots of people. There are also tests for particle size, which goes along with that. If there's less particles, chances are they're bigger. So you'll see people talk about the large fluffy LDLs and the VLDLs, the small dense LDLs. So probably if I had to guess the follow-up test to this, if I did an LDL-P, we would see that my LDL cholesterol is high, but my LDL-P would be low, as in I would have not very many vehicles on the road. But that's just a guess until I can get my hands on that test. What else is interesting here? Alanine aminotransferase, ALT, that's a marker of liver fat. It's a pretty stable number over time. Mine is 16. Now the reference range listed here is from 5 to 45, but as people have been getting fatter and sicker and rates of diseases like NAFLD have been increasing, that reference range has been increasing since the 70s. So probably a better aim is like under 25. And mine was 16. So not a lot of liver fat going on, that's good. Aspartate aminotransferase, the AST, that one varies a little more like meal to meal. So this is all fasted blood work. AST is a measure of mitochondrial function, and a good aim is for it to be less than 20, and mine is 20. The reference range listed here on the sheet is 10 to 35, so that puts me kind of right in the middle of the reference range. But a better, more optimal function is 20 or less, and mine is 20. So mitochondria doing good. Estimated GFR, that's your kidney function. Mine's 80. The reference range is 60 to 200, so right in the reference range. Kidneys are doing fine. Hemoglobin A1C. Now this is often used as a diagnostic criteria for diabetes or prediabetes. What does it measure? So hemoglobin, your red blood cells, they stay alive in your bloodstream for 100 to 120 days. If they interact with glucose, they become glycated. So it's like saying sugar-coated. Glucose in its liquid form, like it exists in your bloodstream, is very sticky. So these platelets, these hemoglobins, become very sticky when they become glycated. The more sugar the red blood cells come into contact with, the more of them are glycated, and they stay glycated for their lifetime, so the 100 to 120 days before those cells die. So the more glycated hemoglobin, red blood cells, that you have, the higher your blood sugar has been over the last 2 to 3 months. So they use this as a trailing measure of your average blood glucose. That's what it indicates. So mine is 5, and this is in percentage. The reference range there is from 4.5 to 6.5. So if you started seeing hemoglobin A1C elevated above 6.5 or 7, that's an indication that you have poor blood sugar control and that you're at risk for diabetes, or maybe already have it. So mine is fine, 5% HbA1c, so that's good. What else do I have going on here? Oh, and then this is the one that I requested from my doctor. She would not normally have ordered this. Actually, she would not normally have ordered any of this. I asked for all of it. But CRP, high C-reactive protein. This is the high sensitivity test. So this is a marker of inflammation, and it's used for cardiovascular risk assessment. If you're in a chronic inflammatory state, it increases your risk of cardiovascular events. So this number, in context with my lipid numbers, my cholesterol, really gives us a sense of like, am I at risk for cardiovascular events from eating this high-fat diet for almost 2 years? And the answer is no. So my C-reactive protein levels are undetectable. So I have no inflammation going on, which is excellent. I don't even hit the reference range for low. It's basically undetectable. So that was great. I was curious about CRP levels, you know, for chronic systemic inflammation, but also just like post-exercise and all that sort of thing. So the fact that it's undetectable is great. I'm super happy with that. Overall, everything is really good. I think the cholesterol ratio, the risk ratio there being, doesn't even hit the chart. My C-reactive protein levels being undetectable. I think that altogether, especially with, you know, stable blood sugar, very little liver fat accumulation, properly functioning kidneys, optimal vitamin D and iron levels, and all those kinds of things give me like nothing to be concerned about. I would, for interest's sake, like to follow up with an LDLP, an LDL particle count, but I'm not even sure if my doctor didn't know what I was talking about. So I will see if I can get my hands on that. Thanks.